It's Dr. Selene here. I hope everyone is doing well. Thank you so much for joining us on our webinar today. I just want to let you know that I know this is a crazy time for all of us and it's uncharted territory. I always say, with different times comes different opportunities. And one of the great things about this is that we get to learn from the comfort of our own homes. And so it's kind of a beautiful thing just to perfect ourselves and work on ourselves. And today we're going to talk about the profound treatment, which I really love. It's something that I incorporated into our practice the last part of 2019. And what really sold me on it was the results were just beautiful. And I had one of the reps, who's a guy in San Francisco, he showed me his results from like 8 years ago. And he's beautiful to begin with, but he maintained his beautiful jawline because of the profound. And I was just super impressed by the results and thought that they were amazing. Sometimes with Botox and fillers, it's not always the right answer. And what I noticed in our field is that people started to look overdone with really full cheeks and just overuse of filler with the intent of trying to lift the lower face. And I realized that sometimes filler is not always the answer. And so we need other modalities so we can keep a natural aesthetic and look fantastic. So this was an option that I found was the best one out there currently that's non-surgical. A lot of people don't have the downtime or the funds to undergo plastic surgery. And sometimes even plastic surgery can look a little fake. And so this is a beautiful option to let your body do what it naturally does to build hyaluronic acid and elastin and collagen. And the science is absolutely beautiful. So if you look this up and you see the histology studies of before and after, it's quite fascinating to watch. And you'll see pictures of myself as I continue to see my results. But lately I've been asked a bunch if I've lost weight. And I think that's a lot to do with just a more chiseled jawline. So I love that, and I'm excited about that. I'm going to introduce you to Carla Bunfill, who's our sales and marketing guru here, and she's fantastic at sharing with you the science. I just want you guys to learn about this before you actually come in for a consultation, because I think knowledge is so powerful, and things like this that are supported by science, what a beautiful thing. So here's Carla for you. She's going to get started on this webinar. You guys take care. So great. Thank you for being a part of this.
All right. Hi, everybody. I'm Carla. Thanks for joining us. We're really excited to talk to you about the profound treatment. There's a couple different things that I'm going to cover. One is how the skin ages, so you can have a better understanding of what's going on underneath the skin and why we're seeing the signs of aging on the outside, like fine lines and wrinkles and saggy, crepey skin. The next thing we're going to talk to you about is how the profound works. So we'll walk you through that. I'm going to show you lots of before and after pictures. We're going to talk about the actual treatment process so you have a better understanding of what to expect when you are going to get your profound treatment. And we've been doing a ton of these. I do a ton of these consultations, and we're just getting really great feedback and already seeing Selene and some of the other girls' results that work in our practice in less than 6 months. So this is something that we talk a lot about and promote a lot because we really believe in it and we believe in the results. So that's what we're going to share with you today. So I'm going to take you through a couple of slides. What the heck? Oh, what's wrong with my slide deck? There we go. Okay, so the profound, it's a non-surgical laser, and it is going to smooth out your skin. It's going to help lift and tighten the skin as well. And so the big thing here is as we age, we go, sorry about that. We go from this triangle of youth where, sorry. Okay, so we go from this triangle of youth where all of the heaviness and kind of curves and fullness is up in our middle face, and our lower face is nice and contoured, and we have a really defined jaw and chin area. And the reason for that is one, is youth, but we have a lot of hyaluronic acid in our skin, we have a lot of collagen and elastin, and all of those things give us moisture, they help support our skin, and also giving us that elasticity in the skin. And as we age, that triangle flips, and so it goes into this triangle where all the heaviness is in the lower face. So a lot of women come in and they complain about saggy jowls or a saggy neck, or even just flat and saggy cheeks. And so that is happening because we're losing fat, bone, and muscle in our face, but also because of our skin. So we're losing elastin, collagen, and hyaluronic acid. And so all of those things lacking in our skin is causing us to see fine lines and wrinkles, sagginess, and crepiness within the skin. So when we're young, this is just a good visual for you guys to see youthful skin versus aging skin. So when we're young, like I said, we have a lot of elastin, a lot of hyaluronic acid, a lot of collagen. And then as we age, all of those things decrease, causing fine lines and wrinkles, sagginess, and crepey skin. So what the Profound does is takes all of these symptoms that we see because of the lack of elastin, collagen, and hyaluronic acid, and it actually regenerates our own elastin, collagen, and hyaluronic acid to get rid of fine lines and wrinkles, help to lift, tighten, and smooth the face. So what is the Profound treatment? So how does it work? What does it do? So it is a laser treatment. It uses microneedling and radio frequency, and it is going to cause an injury into the skin. And when the skin is injured, it's going to try to heal itself. So it's going to produce 2 times, you can see it in the slide here, so 2 times more collagen, 5 times more elastin, and it's going to increase your hyaluronic acid. So what's great about this treatment is we're not using filler, we're not using Botox. It is your own skin properties that have been lacking that are going to be regenerated to give you a smooth, lifted, tightened look. And also in the clinical trials, so there's a lot of data behind this laser, which is one of the reasons, like Selene said, she brought it into the practice, was 100% of the patients had a response rate for their wrinkles. So 100% of people got an improvement in their wrinkles. It also is approved for cellulite, which we will do a whole nother video or webinar on cellulite and body treatments with the Profound. It's really phenomenal as well. But also, sometimes with getting a facelift or surgical option, it can make people look a little unnatural. So that's what's great about the Profound is we're just, regenerating our own collagen, elastin, and hyaluronic acid to give us the nice lifted and smooth lower face. So this is going to kind of show you how it works. So you can see the needles on this side, and then the little blue thing is the heat. So again, it's going to cause an injury into the skin, which is going to trigger your body to heal itself and creating the new elastin, collagen, and hyaluronic acid. So let's talk about before and afters. This is what we all really care about is it going to work, and is it going to work for me? I always tell patients that, the treatment zone is from right underneath the cheekbone to right above the thyroid notch. So we don't get the lower neck, and we do not treat right around the mouth. But you will see in some of these before and after pictures, although we didn't treat around the mouth or below the neck, that they do have some lifting and tightening in those areas because we are regenerating the collagen and elastin and hyaluronic acid around the area. So here's a gal, she obviously has, some saggy, crepey skin around her neck, a little bit of jowling here, and kind of a little fold here around her mouth. And, you know, normally we would just put a little bit of filler in here to soften that. You know, filler in that area can last anywhere from 1 year to a year and a half. So that's what's nice about this Profound, is it's going to treat multiple areas with just one treatment. And it's just more bang for your buck. So in her after photo, so this is 3 months post, you know, this is not going to be something where you see immediate results like filler. It is going to take time for your body to regenerate elastin, collagen, and hyaluronic acid for you to see your results. And so we have, you know, some of these before pictures are at 3 months and even at 6 months that I'll show you. But you can see just in a short 3 months, she's got a nice defined jawline. All of that crepey, saggy skin is tightened and smooth. And even that, you know, little nasal labial fold here has been softened. So she looks really great. And one treatment can last you 5 to 10 years. So that's what's nice about this too. You know, with filler and Botox and lasers, you know, other lasers that we use in the practice, you do have to have some sort of maintenance to maintain your result. Whereas this is one treatment, it's gonna last you a long time, give you a really nice natural result. I love this angle too as well, just to show off that sleek jawline that she got and then what it did for around her mouth. Looks great. So here's another patient. This is 5 months post-treatment. You know, a lot of our patients come in complaining about this saggy jowl. So because we lose fat in our face, the fat pads actually they flatten, they separate, and then they fall. And so what you're seeing in a jowl is just a fallen fat pad. And they're, you know, we treat them surgically. We can put a little filler along the jawline to help, but the Profound really gives that nice natural result by getting rid of that jowl. And then look at what it did and tightened up her neck. She looks really good. And you can even see around her mouth has been improved as well. And that's 5 months post, one treatment. So here's more of an older patient. I do get a lot of questions about, you know, how old should I be, or am I too old for this? And it's really, you know, depends on your skin laxity if you are a good candidate. But here's an older patient who's got, you know, a lot of crepey and saggy skin all along her lower face. And this is her at 6 months, just one treatment. And you can see, I mean, she looks about 5 to 10 years younger. She looks great. So you can get results even if you are an older patient. So this patient I love because this is our typical patient. You know, she's got some folds around her mouth here, not that great of a jawline. And typically, you know, for her, we would recommend several different sessions of laser treatments. We would also recommend some filler and some Botox. And in just one treatment and one Profound treatment, it did all of those things that, you know, filler, Botox, and other lasers can do. So that's what's really great about this procedure. So something else that this laser can treat is the little submental fat underneath the chin. So a lot of people struggle with this and you know, it makes them look heavier than they are. And a lot of times it's based on your genetics. So you can look to your parents and, you know, if they have a double chin, most likely you're going to have one. And no matter how much you diet or exercise, you just can't seem to get rid of it. So the Profound treatment is reducing that little submental fat to just give that nice lifted jawline. I mean, she looks great. And this is 3 months post. Oh. All right, one more of kind of the submental fullness here. So you can tell she's a younger patient, doesn't have a lot of folds or wrinkles or anything like that, but it's more about reducing that submental fat and getting that nice jawline. And this is her 4 months post. Okay, so let's talk about the actual treatment itself. So it's kind of a long appointment for you. It's about an hour and a half treatment, just getting the laser treatment itself. And we have you come in a half an hour before your treatment and we topically numb you. And then we have you come back and we inject lidocaine and epinephrine into the skin. And I have a little video of that just to show you what you can expect during treatment. I always like to lay everything out in front of people so they know exactly what they're getting into. So as far as side effects too, you're gonna be swollen and bruised. I mean, it's just gonna happen. You know, the first 5 to 7 days are probably going to be the worst. I do have some really great progression photos of someone immediately after treatment, all the way up to 7 to 10 days. So I will show you that in a minute. So a couple things that you do need to do before the treatment, and we'll send you all this information too, so you don't need to memorize this, but you want to just stop taking anything that's going to thin your blood, anything over the counter like aspirin, any type of vitamins, anything like that. You know, try to not drink alcohol the night before, and just, you know, don't use anything that's going to irritate your skin like a retinoid or other topical things, and just try to be clean and not put any makeup or anything on before your treatment. We like a clean face, and we'll have you wash here too. So kind of what are the contraindications? Kind of the main thing we need to know is if you have any autoimmune disorders that are going to impair your healing process. Because we are poking needles into the skin, we need to make sure that your body heals properly. So that's kind of the biggest thing that we need to know about. Also, if you have any thread lifts or permanent fillers, metal implants, those types of things we do need to know about. And so after treatment, you're going to ice, you're going to use a mild cleanser. You're not going to put, you know, a lot of any makeup on. We really want you to stay off the makeup for a couple of days. You don't want to be going into the sun or the heat. And I'm going to show you some of these pictures so you get a better idea of what that healing process looks like. So this is pre-procedure. It's our patient. Different angles. So this is post-procedure, the night of, after treatment. So very red, swollen. This is next day in the morning. So she's even more swollen. You can see. This is her from the side view. So this is her day 2. So I feel like, you know, by day 2, you get even a little more swollen than you were before, but the redness is clearing up very well. This is her from the side. So by day 3, you know, she's looking a lot better, still pretty swollen though. And this is all normal. You know, some patients, it kind of looks like she has acne on her skin. So some patients do say that to me. That's her side view. So here's another one, day 5, so significantly better. So between day 5 and 7, you're really gonna start to notice the swelling and all the redness go down. So she looks really good at day 5. So, and here's her at day 7. I mean, she looks great. She looks normal. She can put makeup on. She can go back to work and go back to her social activities. And then this is her side view. And then here's her at day 9. She looks great. She looks fully recovered. A little bit of redness still. It kind of looks like she still has, you know, kind of the little acne going on, but that's all normal. And so this, a couple of videos I like to show you guys how we numb the face. So this is...
Like there's certain spots I don't feel it at all.
So this is Janine here, getting injected with lidocaine and epinephrine. So this process can be uncomfortable. She said on a scale of 1 to 10, 6 was her pain level during this, but it's fairly quick, so you don't have to, you know, suffer for very long. But it is necessary for us to numb you at a deeper level so you can get be comfortable during the procedure, because it's a long one. It's an hour and a half. And then here is the actual
You doing okay?
Yeah,
procedure. And you can see the little blood is from the needle pokes. And then the heat. And so that's the actual procedure right there. I do have a couple more post-treatment pictures that you guys can see. So this is immediately after treatment. So swollen, redness. Day one, she does have some bruising. So we didn't see as much bruising on the first patient, but you can see she's got a lot of bruising and it looks even more like acne. You know, day two is going to be worse. It's going to get worse before it gets better, and that's totally normal. But again, you know, if she, you know, had to go out and do something, she could totally, you know, get away with it. You don't really have to hide like we do with our big CO2 laser that totally ablates the skin, and we don't want you to have any sun exposure. So, you know, depending on how comfortable you feel, you could go out like this. So this is her day 7. So looking much more normal, almost healed. And then this is her at day 14. So that's 2 weeks later. She looks great. So you do have to be patient with the results. You know, you just have to know to get through kind of the downtime. And then once you do, you know, and you heal, you're slowly and gradually going to start to see the lifting, tightening, and smoothing into the lower face. So if you are ready to learn more about the Profound, I would love for you guys to schedule a free consultation with me. It's 30 minutes long. We can do it over the computer. You don't need, obviously, come in. And I will see if you're a good candidate and if this procedure is appropriate for you. And then we can schedule your Profound laser. The cost of the product, I'm saving it for last, is $3,000. And that includes everything. So that includes all your numbing, that includes the treatment time and everything. And so it's very reasonable price. You know, some of our patients, by the time they spend money on filler and Botox, you know, it's $3,000 when they can just do the Profound. It's more bang for your buck, and it covers way more areas, and just does something different. You know, it's our own bodies stimulating our elastin, collagen, and hyaluronic acid. And that's where we're going to get tightening, lifting, and smoothing in the lower face. So I hope this was helpful for you guys. We really want to help educate our patients. That's really important to us. That's why Selene hired me. That's why I'm here. I really want everybody to get the right information and just, you know what they're going to get themselves into, know what the cost is going to be, because that helps us make, you know, better decisions. And our goal is for everyone to look great, feel great, so you guys can do great things.